start at exactly 6 o'clock because we do have a hard stop at 8. And we want to have our representatives have time to make sure they speak and give us the information that we need
If
to
I
hear.
can interrupt, I have some people asking me that they were asking for a passcode.
There is no passcode. It's
There
just
is
a
no
link.
passcode.
No.
Okay, thank you.
Hi, Paul, how are you? Everyone, Mr. Neil, Jordan, everyone, Beverly Hilton. Okay, greetings, Rachel, from Senator Rivera's office. Thank you, thank you, thank you, thank you. Greetings, everyone. Mercedes, we ready?
Yep.
Good evening, everyone, and welcome to our Veterans Advisory Board session. My name is Wendy McClinton. I'm the chair of the New York City Veterans Advisory Board. And today we want to greet everyone in their respective places. We want to acknowledge everyone that's here today because today is a very important meeting. It's a discussion so that we can receive information, as much information as we can to understand the proposed VA closings. So with us, we have today, and I'm going to let with us, we have today, Rosemary Cancel Santiago, welcome. She's the director of the James J. Peters VA Medical Center. And we also have Mr. Bruce Tucker, who's the director of the VA New York Harbor Healthcare System. And so we want to make sure we allot them time to make sure that they give us the information about the proposed closing. Also, what we want to do is do a little bit of housekeeping. This VAB session is strictly dedicated to the closing of the proposed closing of the VA healthcare hospitals or the upgrade of others. We're not going to be able to answer your questions about not being able to get appointments and all that other great stuff. So we ask that you utilize the chat for anything else other than the discussion about the proposed closing of the VA hospitals, okay? And then if you have a question, please put it in the chat. But what we're having is you have to give us your email address or your telephone number so that we're able to get the answer back to you. So it's not enough to have the question. A lot of you are leaving great questions and we've got good answers, but we can't get back to you because we don't have your email address or a cell phone number. All right. So please, let's just be mindful. I'm going to take a few minutes. I'm going to take a few minutes. And I just want to make sure that we have all of if there are any elected officials on the call, please. We have Rachel from Senator Rivera's office on the line. I'm just looking through real quick to see if there's any other, hello everyone, but the chair of the Bronx Community Board 7 is on the line, welcome. I just want to make sure I acknowledge everyone, the elected officials. And while I'm doing that, will the VAB board members that are on the call, would you please acknowledge yourself?
Good evening, everyone. My name is Mercedes Elias. I am a Marine Corps veteran and I represent Queens.
John Rowan, Air Force Vietnam veteran from Queens.
We got Todd Haskins, Marine Corps veteran from Manhattan.
Paul Dietrich, Army veteran, Staten Island.
Ralph Costello, U.S. Air Force veteran, Vietnam.
Richard Chan, U.S. Navy veteran, Vietnam.
Thank you, everybody. It's for the advisory board members only, not everybody.
Oh, okay, I'm sorry.
No problem.
It's okay. We're good to hear from you. And then can we acknowledge also the members? We have the Commissioner James Hendon. Acknowledge your team, please, on the line.
Hey, you've got James Hendon, Commissioner of New York City Department of Veteran Services. Also with me are Deputy Commissioner Paul Vallone and Chief of Staff Cassandra Alvarez.
Thank you, thank you, thank you. So what we want to do, we want to get started because we want to have a healthy discussion. We want everyone to be able to share, and then we're going to be respectful of time. So if you have your question, state your question in a minute and allow our VA representatives to answer because they're the ones here with the answers that we seek. All right, so.
Wendy,
okay. Thank you, Councilmember Holden. You're on the call as well. Councilmember Holden, who is the chair of the Veterans Advisory Board. Would you like to give words before we get started, sir?
Sure. Hi, everyone. Good evening. And spring has sprung. So it was a beautiful day in New York City. aside from what was going on, obviously. But welcome, everyone. And Wendy, it's a pleasure to be here. Do I have a few minutes to go over a couple of things?
Yes,
Or-
sir.
Sure. Okay, great. So I'm joined here with my legislative director and Craig Caruana. Where's Craig? There he is, waving his hand there. And is anybody else on from my office? I don't believe so, right? No. Okay. So I asked Commissioner Jenkins of Department of Social Services to send a representative to the Veterans Advisory Board meetings going forward. Because when I was on last time, we had nobody from that office or agency, and he agreed. And tonight, do we have Eric Paulino? Is he on?
Yes, council member, I'm here.
Okay, let me just find you here. Okay. All right, great. So I had a hearing from the Veterans Committee on homelessness, veterans homelessness. And, it's funny that DHS at the time had really kind of none of the data I had asked for and some of the other council members asked for. So we have a lot of work ahead of us, and hopefully we'll get that information and respond to the needs of homeless veterans. And by the way, I made a surprise visit to the Borden Avenue Veterans Shelter. Learned a lot from that. I don't know how many on the call have been there, but I was a little surprised. One part of it that was funded by the Veterans Administration, and this is a city-run facility on Borden Avenue in Long Island City, but the part that the VA ran or runs has these nice little modules, 8x10 modules that the veterans have some privacy. It's like an 8x10 room, has a bed, has a locker, has some little dresser, and it's a private area. But the part that the DHS runs, Department of Homeless Services from the city, is in the back, and it's congregate. That means they're sleeping all out in the open. And I was told that at one time the whole shelter had those little modules, those 8x10 modules, and but the DHS, New York City DHS, took them out sometime in the last few years, whatever. And I want to get them back. And I've already spoken to DHS. I've spoken to the mayor, by the way, about it. And I showed pictures of the module, and he loves it. The mayor loves them, and maybe he'll even spread to some of the other congregate shelters. That's a positive. So the modules are I think are much safer. Even the director of the shelter said there are less fights in those. When you have a module, you have your own private space. So obviously, there's going to be less fights and arguments and so forth, and a lot more privacy. I didn't like many things about the shelter. Some things were good. I think it's well run, but everybody, all the veterans there complained about the food, and here's why. And I brought this up at the hearing, and I think Wendy, you saw that. It's a very small portion. I wish I had it here to show you. It's a very small portion that's comes frozen, and they microwave it, and it's about the size of my hand. The portions, like the whole tray. So they might give them 2 trays of it, but it's never fresh food. And they have the capability. Before the pandemic, the Borden Avenue shelter would make their food on premises and have a provider come in and do that for them. And that went by the wayside during the pandemic in the last 2 years. And the vets deserve better. I said that everybody deserves decent food. Obviously, this is not decent food. And there's a lot of problems with that. So I got a commitment. I think I got a commitment kind of that they're going to look into bringing that food service back and cook on the premises, and even try to have some volunteers, help out, and even some veterans help out. So, I'm also circulating another matter. I'm circulating a joint letter to my council member colleagues opposing, obviously, the closing of the VA hospitals. And I know how damaging these closings will what they'll do to our veteran community. And like I said at the press conference, this is personal because my dad was there many times throughout the 60s, 70s, and 80s, and even into the early 90s. And I used to drive him there with my mom. And then even on weekends, my mom would go there and visit many veterans as possible to read to them. So that's important for us to keep that open in not only Manhattan, but in Brooklyn and in the tri-state area. We should have really options for our veterans. So so that's it, Wendy, and thank you, everyone. And I'll stick around. And I see my former colleague, Paul Vallone, on this, and and thank you for all your participation, all your work for veterans over the years. So thanks so much, everyone.
Thank you so much, sir. Thank you for your commitment. Thank you for your steadfastness. Thank you for all that you do to make New York City and New York State veteran friendly. And to everyone on this line, this is what we're trying to do and working together. No big I's, no little U's, just all of us doing everything for the betterment of this veteran population and the veterans of New York City. So what I would like to do, I would like to turn this over to our visiting guests, Ms. Cancel Santiago and Mr. Bruce Tucker, and they're going to come in their own way, allowing each of them time to share what they need to share with us about the proposed closing of the VA hospitals. Ms. Santiago, would you like to go first, and then Mr. Tucker, or whichever order you would like to prefer to go in?
I know that she's on also. My name is Bruce Tucker. I'll start, if you don't mind, and then I'll hand it over to Rosemary. My name is Bruce Tucker. I'm the interim medical center director here in the Harbor, which is St. Albans, Manhattan, and Brooklyn. As both of us, and when we go through the market assessment recommendations, I know people are going to have questions, but we may not necessarily have answers because of where this is in the process. And I know that probably most people have heard bits and pieces of those recommendations through the media. So I kind of want to go through where we're at in this process for both. So because with Rosemary and I, we're in the same process because this is the process across the country. So I just kind of want to outline that and then also do introductions for ourselves. So like I said, my name is Bruce Tucker. I'm the interim medical center director here. My full-time regular job is I'm the medical center director at the VA hospital in Finger Lakes in upstate, Bath, Canandaigua, Rochester. I moved down here after Martina retired at the end of the year. I'm happy to be here. We're doing some great things. The one thing I do want to emphasize, and I'm sure Rosemary would echo this, is that the staff down here have been very good. The veterans are great. Really enjoy working down here, getting to know the veterans that come in and utilize the facility. The staff are very dedicated, and the staff are our number one resource in terms of treating veterans, and we want to make sure that everybody knows that, and that we are still, no matter what happens, we're an employer of choice, and we want to emphasize that because we don't want people to be concerned because of these initial recommendations about their positions or the veterans that receive care here about their ongoing care here in the New York City area. Where we're at in this is these are initial recommendations out of the market assessment. So that was a paid consultant that did numerous interviews with veteran stakeholders. They looked at data starting in, I think it started around 2017. Those recommendations became public. I think it was March 14th. We did work with Mr. Hendon's office. We tried to get some transparency before actually the recommendations came out. So after these recommendations come out, it goes to the AIR Commission next, which is a congressional appointed commission, AIR standing for Asset and Infrastructure Review. So that could take even a year. So those recommendations go to the AIR. Then the AIR will look at those recommendations. They'll involve stakeholders. And then from there, it goes to the president, and then it goes to Congress. So anything that's happening now in terms of those market assessment recommendations They may look very different at the end of this process. And then no matter what's recommended final could take a very long time to implement. And neither Rosemary or myself could really predict on what those recommendations are going to look like at the end. I know that a lot like Senator Schumer, Malliotakis' office, and the city's mayor's office has been very vocal about those. And I'm sure that those voices are going to be heard as part of that AIR Commission. So with that, I'll hand it over to Rosemary so she can introduce herself.
Thank you, Bruce. My name is Rosemary Cancel Santiago. I'm the interim medical center director here at the Bronx VA Medical Center. My official position here at the medical center is associate director. I've been interim director since December. Our former director, Margaret Kaplan, retired. And I've been asked to step up and provide some leadership while we go through the transition and recruitment. As you may know, the Bronx facility is a 1B healthcare complexity facility, and we are a regional referral center for multiple specialties, including bariatric surgery, spinal cord injury, polytrauma, amputee care. We're a center referral for SCI, which is spinal cord injury. And we have affiliations with 3 academic medical institutions, premier academic medical institutions, which is Mount Sinai, Hospital for Special Surgery, and New York Presbyterian Columbia. We have over 284 beds, inpatient unit, also servicing outpatient units. We see over 30,000 encounters and service over just about 28,000 unique veterans. And located in the Bronx on a 30-acre campus, we have some aging facilities. I do want to clarify and say that Ms. McClinton is voicing that the VA is going to close. The VA is not closing. Our services are not going away. Our veterans are the cornerstone of our facility. And I empathize and I could relate with Councilman Holden's comments on his parents being veterans in our facilities, because my dad and my granddad were veterans in this facility. And just picture, back then in the 70s and even before that, we've been providing care to our veterans, but we have an aging infrastructure. And we really need to modernize and upgrade not only our facilities, but the way we deliver the care. Often today, we see our veterans traveling, long from, in New York, a congested city, for an inordinate amount of time. Sometimes the commutes could be really taxing on our veterans, particularly our elderly veterans that live further away. So our mission and task is to ensure that we have those services that are readily available to our veterans, regardless of transportation. And I just want to, show you, if I can, share my screen here just for a second. Can you see the screen?
Yes.
You see this? So here are some of the challenges that we're facing as a VA. There's aging infrastructures, and you know what? Our veterans deserve better. And, the goal is to upgrade these infrastructure. Again, upgrade infrastructures, take the recommendations, and to emphasize services aren't going away. VA is here to stay, and so are our employees. They're the cornerstone to service delivery. And the goal is really to set up high performing networks. And as you see here, this is the future state that we like to obtain and build a healthcare network that's the right place and provide the right care, leverage and our partnerships within the community, and position the VA to really be a network, full performing network beyond what we see today. So I just wanted to, let you know and include that. I'm going to stop sharing here for a second, if I can, but before I do that, I just want to show you as well, just the timeline to go back to what Bruce was saying. I can do this here. Let me see. Can you see my screen? Are you able to see that? This is just a general timeline on how the market assessment commenced here. And they put together this timeline as required by Admission Act of 2018, they conducted market assessments for each VA healthcare facility. And like Bruce mentioned before, the secretary will submit recommendations to the Air Commission. Again, they're recommendations, and we won't see any of those recommendations come to fruition no sooner than 10 years or more. Am I right, Bruce?
That's correct. And you know, the other thing I think in terms of what we're doing right now to kind of tag on to what Rosemary's talking about is our current plans in terms of short and long-term plans that we have today remain the same. Now, when they come through at the end of this, whenever this process is finished, that may need to be adjusted based on whatever the recommendations come out of the congressional approval process after it's reviewed by the president. So, but as of right now, like, and I'll take the harbor, for example, we have a lot of projects in terms of updating our infrastructure, because as Rosemary did talk about, and if you've been in, and I'm sure most of all of you have been in our facilities, they are older, there are some issues. If you've been in Manhattan, you know, I tell you, the elevators are an issue, and you know that if you've been here, which we are trying to get those up and running and getting the full bank going. And that is a project we have going on right now. That project doesn't stop. Our HVAC systems doesn't stop. We're updating inpatient units right now. That doesn't stop. Now, what Rosemary said is true, and that's part of the problem, is that we have old structures that we're trying to get ahead of in terms of making those modern. In terms of what we're doing, we have our projects that we've planned out 5-10 years. Those still remain in place. Now, at the end of the final review and what's being rolled out to the VA, like I said, we may do a course correction on that based on that. But as of today, what we have set is what we're moving on. And the other ironic thing that Rosemary has, you know, like I said, I'm the medical center director in VA Upstate and Finger Lakes. And 2 of those pictures that she showed are from my facilities. One of those pictures was from Bath, and the other one is in Canandaigua. And one is from the 30s, and actually one of those buildings is from the 1800s. All right, so what we were going to do is we were going to have Rosemary go through her market assessment recommendations, and then I'll go through my market assessment recommendations, and then we can open it up. But at the end of it, you'll know pretty much as we do. So I'll hand it back to you, Rosemary.
Thank you, Bruce. Okay, so one of the recommendations for the Bronx, as you know, we have services that we have an outpatient center in Queens. So one of the recommendations is to realign those services within the other medical centers and or the community, and strengthen the partnership so that we can service the veterans in the Queens location. The other is for us to really modernize our existing inpatient unit, our medical and surgical inpatient rooms, so that we can convert those to single-bedded rooms. And what this will do is to meet the modern standard of care to improve veteran satisfaction and provide greater flexibility and privacy, and of course, increase family engagement in the care of that veteran. In addition to modernizing in place, we are also establishing constructing currently as I speak, a new inpatient mental health unit. And we're going to convert this calls for converting our current mental health unit to single-bedded rooms to meet the modern standard of care and improve, again, veteran satisfaction, provide for greater flexibility, and increase family engagement. In addition to that, we're looking to have single-bedded rooms for our community living center, also known as the nursing home. Again, the idea is of these conversions to single-bedded room is to improve the veteran satisfaction, increase family engagement. and strengthen the wellness of services by enhancing complementary services like chiropractor, acupuncture services, rehab therapy, which is projected to grow over the next 10 years at the Bronx VA, expanding these services to increase access, transition our inpatient spinal cord services to absorb East Orange, which is the VA in New Jersey's spinal cord injury unit. In addition to that, we'd like to expand and create partnerships that would include enhancement of services with community providers to provide women's health services. We want to provide a whole comprehensive one-stop shopping center for women's health services within our facility. We know that there's been an increase in women's entering the military in different branches, and we want to be able to offer them comprehensive services. Right now, we're referring to the community. We don't want them to go to the community. We want to keep them here. And again, it's a one-stop shopping center from mammography to general top GYN, also extend those services to integrate healthcare with other specialties within our medical center, expand and increase the use of telehealth. As you know, the pandemic has really thrusted us to use the technology a lot more than we have been used to. So we want to continue to enhance those services. We've seen a substantial increase within different geographic areas, our general catchment area. And I think that this market assessment will poise the facility to continue to enhance those services and increase access to care for our veterans, modernize our facilities, strengthen our partnerships with high quality healthcare providers. And really it's an emphasis on outpatient care and bringing the medical home model into the home actually. And it calls for major renovation, not only of the infrastructure of the facility, but the general service delivery of care. And, veterans are and will always be at the center of our healthcare services. These recommendations are being made to ensure that the VA provides the best and most up-to-date care to our veterans today and in the futures, and for the future generation of our veterans. And this process will ultimately, help us to, drive that care that we see today at a much different level. So it's intended to enhance and expand services, not in no way to deplete them. So those were the recommendations for the Bronx. So Bruce, I'll turn it back over to you.
All right, thank you. As Rosemary said, Bronx sees about 28,000 unique veterans per year. New York Harbor sees just under 50,000 per year. It's a 1A full service facilities. If any of you come to the harbor, know that. As Rosemary said, the market assessment did look at the aging infrastructure, but it's not, veterans are the center, our employees are also. So I'm just going to actually go through the recommendations, and I think most of you have probably heard most of these recommendations through the media anyway, so I don't think anyone's going to be too surprised by any of them, but I'm going to go through each one bullet by bullet. And I'll start with the Manhattan campus. We can send the public link out. Wendy, would we send that to you and then you can distribute it? It's just the public market assessment link. Would that be best? That'd
be fine. Or you can send it, put it in the chat, and Mercedes is there. She can take it and we can send it out to everyone.
Okay. What I'll try to do after we're done here, because I can't multitask, I'll end up disconnecting myself. I'll drop it right in the chat afterward.
Okay.
I think I can get it dropped right into the chat. I'll just copy and paste it and put it in the chat. So, and this will be, you're going to see pretty much what I'm going to read to you, which I think is probably more what people are more concerned about, because these are some big recommendations for New York Harbor. So the Manhattan campus is, and I'm just going to read it. So just be patient with me. Is to establish a strategic collaboration with a high quality partner such as an affiliate to replace the Manhattan campus to provide inpatient, outpatient service, and discontinuing these services at the Manhattan campus. Relocate the ED services from the Manhattan campus to the community provider and discontinuing ED services at Manhattan. A new urgent care center would be part of the new collaboration. If unable to enter into a strategic collaboration, the Manhattan campus status will be status quo. So to paraphrase what I believe that is saying is that if there is, and it's successful to set up a collaboration, the VA would have a footprint in another facility, and we'd have a urgent care in that. But if unable to do that, it would remain status quo. That's the recommendation that's going to the Air Commission for Manhattan. The Brooklyn campus is to establish a collaboration to provide inpatient medical and surgical, outpatient surgical, ED services, and discontinuing inpatient medical, surgical, outpatient surgical, and ED services at the Brooklyn campus. If unable to enter into a strategic collaboration, the Brooklyn campus would remain status quo. Relocating the Harlem CVOC to a new vicinity in Harlem. Realign the Staten Island multi-service CVOC to the New Jersey healthcare system. Expand mental health services at Staten Island. Establish a multi-service new CVOC in the vicinity of Brooklyn, which I believe would be to try to relocate that closer to where the veterans are in public transportation. Relocate research, all research at Brooklyn and Manhattan into the Manhattan strategic collaboration, if that is what is finally recommended. And moving on to St. Albans. Because of location of St. Albans, favorable location to create a subacute campus for the 5 boroughs of New York City and Long Island, establish a new modern facility at the St. Albans campus, ensure right sizing the facility to deliver high quality outpatient mental health, CLC, which is nursing home care, subacute care, which would be also part of CLC, which would be like transitional care for like rehab services. Relocating the domiciliary RRTP from Brooklyn to St. Albans. The potential changes could be 10 plus years away if approved as recommended. But like I said, this is the initial from the market assessment, which started in 2017, which will then go to AIR, which will then go to the president, which will then go to Congress. And those are the recommendations, and you'll see those recommendations written out. Like I said, I'll drop it in the chat box. So Wendy, I'll hand it back to you.
Thank you so much, Bruce. Thank you so much, Ms. Santiago. And thank you so much, because all that we have to clarify, all that we've been hearing, and that's what I wanted to, be able, maybe you can answer. All we've been hearing that certain VA hospitals are closing, certain VA hospitals are being upgraded, so we need to try to get that down packed so we're able to give out the correct information, because it was said the Brooklyn VA was closing, Bronx is being upgraded, Queens is being upgraded, Northport is being upgraded or closed, so we need to find out in those recommendations, and you're here representing the VISN. What about the other hospitals? Ms. Santiago was able to talk about the Bronx. Is the same recommendation going to be for Brooklyn?
I got a hold of Frank.
I'm sorry?
And he sent me the other thing, which I never got, and now I'm in.
Okay.
So maybe you should try again, because I got.
Okay. So if we can do that, and also if I can ask, because before I open it up, and I want everyone, but if Mr. Tucker and Ms. Santiago, if you could look through the chat, and if you look through the chat, we have several questions that people want to know. One question I had, you said these recommendations are going to maybe take place the next 10 years. Will the infrastructures last that long during that 10-year wait period? And then, how are they going to, once they start the restructure, they're going to move people out? Will it close? Where will everyone go, for care? Is all of that part of the plan?
So Wendy, I just want to, if I could touch on those things too. And I just want to make sure that people realize these are still just recommendations very early in the process. So it's still, these are not final. So what comes out at the end, it still has to go through multiple stages of review and process. So nothing is changing as of right now in terms of how we are treating the veterans or our infrastructure plans. So, and this is the way it is going to be for Rosemary. This is the way it's going to be for me. I can't speak for Northport, but I can tell you this is going to be the same. All of us have very short and long-term infrastructure plans in terms of capital improvements. None of those change right now. We are pursuing our capital improvements. We have current projects going on right now, and those projects are all going to move forward. We're looking at we're going through projects right up through 2030 right now. We're still pursuing those projects right now because it takes a long time to do those projects. We can't hit the brakes right now based on recommendations. Now, at the end of this, when this is final in terms of what direction the VA is going to go in, that will shift direction. But as of what we're doing today, like I said in the beginning, I know I can't talk to Rosemary's, but I have an elevator project going on right now. That is not changing. I have an HVAC upgrade going on. That is not changing. All those things that we have an ER upgrade that we have in projects right now. That's not changing. We're moving forward with all of those things.
Okay, excellent. Were you able, Mr. Tucker or Ms. Santiago, are you able to look through the questions in the chat? And
Okay,
maybe we can try to see if we could answer.
Wendy, I have the questions from the chat, but I can do, Ian's had his hand up first. So Ian, we'll give you the floor. And then after you, I'll read through the questions that have been put in the chat.
Thank you. Thank you so much. Okay, yeah. Forgive me because it's not yet clear about closings or whether or not hospitals are going to stop treating patients. And I just want to say, look, the veterans rely on that integrated comprehensive care, right? Are we disrupting that? I don't know. When we talk, the notion of closing hospitals sounds like we're somehow disrupting that. But it sounds like here that this is, hey, we're rebuilding infrastructure, which I'm sure everybody's in favor of building better things. What does this mean to the integrated comprehensive care that the VA provides to New York City veterans?
The goal is no matter what comes out of it, whether the services are provided in the facilities that as is right now or in whatever is going to look like in the future, the goal is to provide top quality care to the veterans, no matter where it is. That doesn't change. In terms of, holistic, comprehensive care, that's the goal. That's the goal. In terms of these, I want to emphasize that these are still recommendations, but the goal of providing veteran care is not changing.
It's still just not clear to me whether or not specific hospitals in New York City that the plan that perhaps is the jargon that's used, but I just don't know what some of that meant. Are they talking about closing of
those were the
facilities that were
two.
mentioned?
So for Manhattan and Brooklyn, the recommendation from the market assessment is if they can enter into a strategic collaboration and all those things are checked, then the potential for the hospital to close and move into that new collaboration would happen. That's the recommendation from the market assessment. So I can go through that again. So these are the recommendations, but still it has to go from market assessment to AIR to president to Congress. So the recommendation, and I'll go through it again real quick. And I see Mr. Hendon dropped the link in. So, and it's going to read pretty much what I read to you, which is for Manhattan, establish a strategic collaboration with a high quality partner such as an affiliate, to replace the Manhattan campus to provide inpatient, outpatient services, discontinuing these services at Manhattan, relocating ED.
Total garbage.
Relocating the ED, and then having a footprint in that strategic collaboration if there's no change in these recommendations. And it's a very similar to Brooklyn, but then Brooklyn, they would be building a new multi-service clinic. That's the recommendation at this stage.
And just to clarify one last thing, I promise this last thing. And is there anything in these recommendations to do with privatizing some portion of care currently provided by the VA? I thought I heard that mentioned in the,
So what it is it's the strategic collaboration they're talking about would be with a private partner.
Now, just to clarify, that would be, the veteran is still, this would be part of the integrated care. That partner would be seamlessly integrated into the VA system, or is this, are we making this harder for veterans to get health care?
I think it's too early to say what that would end up looking like in the end, because it's so far in the beginning of the process. So to answer your question,
we got to think that far out, right? We got to think that far out.
I agree. I mean, if you're going to think about a plan, the plan is to facilitate the veterans, not so much as to what facilities we could cancel. Are you canceling Brooklyn and Staten Island?
Well, I want to make it clear, that we're not canceling anything. These are initial recommendations. I want to make that very clear. And the other part too is the Staten Island recommendation was to actually expand services at Staten Island, not reduce services at Staten Island.
So the Brooklyn facility will remain as it is, open for our veterans with full services to them.
The recommendation from the market assessment would be if you can establish the strategic collaboration to provide inpatient, medical, outpatient, surgical, ED, would be then to discontinue those at that campus and build a new outpatient clinic.
I think that we all agree that the facilities need to be updated and the care for a veteran should be upgraded.
Mm-hmm.
But we're still not clear of how that upgrade is going to take place.
In terms of where we're at right now, this is where we're at in the beginning part of the recommendation. I don't think there's a clear indication yet on how that would take place because it still has to go through multiple steps in terms of what it's going to look like.
Will you send out to all the veterans the proposals with the various steps that has to take place so we could all review them and see if that makes sense to us, to who have the care?
So Mr. Hendon dropped that link right in the chat box. So that's there.
I have a question, if I can speak.
Sure.
I keep hearing this privatization. What makes anybody think that a private doctor knows what the ailments of a veteran is, the way the New York City VA system knows? We keep incorporating this privatization, which I personally think would be a total disaster. You comment?
Yes, no, I think I'm 100% with you. And this is not just our opinion. The feedback on veterans with the veteran healthcare is that they like getting their healthcare from the VA because it is a fully integrated, comprehensive healthcare system. And yeah, just like some of the folks were talking about the connections that they have with the academic institutions, and they train there, and there's a whole, I'm sorry, I just wanted to concur. I just wanted to agree that I think it's that's a terrible idea. I hope everybody's on board with that veterans actually do not want privatization of any part of their healthcare. I hope that's
I
clear to
agree.
everybody.
I agree.
Absolutely.
Yeah. I hope that's clear to everybody.
I agree.
Question.
Yeah, so we're gonna stay with the people that have raised the hand in the chat, because if too many people try to start talking, then it's just gonna kind of create some confusion. So next would be the hostess, Office of Veterans Affairs, who's had it up for a while. Thank you.
Thank you. Thank you so much. Good evening, everybody. My name is Ricardo Garcia. Many of you here probably know who I am. I've worked for an extensive amount of years in advocacy for behalf of our veterans. I just want to touch on two simple things. One of my questions for Mr. Tucker is the actual the EHCP, the model which was used to create this assessment, and it heavily weighed on the AIR report that was submitted. So the model, the VA's enrollee healthcare projection model, it showed a steady decline in the number of veterans that utilized the VA, and it showed a steady decline in the number of veterans that are exiting out of New York. I actually take issue with that model. And the reason I take issue with that model is because, first of all, it was done during a pandemic, the COVID pandemic, which obviously is going to be a hindrance, and it's going to take away from the true number of individuals that are utilizing the VA. Secondly, that model doesn't include dependents. It doesn't include active duty service members that are utilizing the VA healthcare system, in addition to the reservists that are utilizing the VA healthcare system. So with that being said, that model is flawed and those numbers are skewed to begin with, Mr. Tucker. Secondly, the other issue that I have is that, and someone pointed this out, the VA has not done a good job of promoting, the services to capture our younger veterans. We need to have these services around for an extended period of time, because right now it's the Vietnam era, the Korean War era veterans that are utilizing the VA healthcare system. But very soon, in the next 10 years, it'll be the OIF, the operation, the OEF, veterans that will be utilizing. So these systems need to be in place, for that influx. Also, the way I looked at the ARR report and I read it thoroughly. Page 56 to 71, for those of you that haven't read it, I recommend you read it, 56 to 71. The recommendations there are to close the VA and the Manhattan facilities, and to really relocate those services. And I know these are just recommendations, as you stated, Mr. Tucker, but has anybody done an impact assessment on how that would impact the Bronx VA and the Queens VA? Because that influx is unsustainable. It's absolutely unsustainable. You cannot fit that many healthcare providers in one facility. The services that need to be rendered are just, it's a mammoth tasking that just will not be able to be met, and that burden of healthcare will steadily decline for our veterans. So I know there was quite a few things that I've mentioned here, but whatever you want to take away at Mr. Tucker, or whoever has any knowledge on the information I just put out, please, by all means, go ahead, chomp away.
I want to two things I wanted to just touch on with what you said, because I agree 100% in terms of engaging veterans and getting them in the doors. And so we have committed to doing that. And I don't know if any of you know Lynn Johnson. He goes out on a very regular basis to do that and works with many of you. And he's very committed, and we are building a team around trying to work to get veterans that don't utilize the VA into the VA. There's a large pool of veterans out there that do not use the VA that are in the catchment area. So we need to do that. In terms of the other thing I just want to touch on is that this is the market assessment recommendations. It's not quite yet. It's going to AIR, which is congressionally appointed. So Market Assessment was a private company that did this. Now it's going to air, which is congressionally appointed. So in terms of your concerns, it's going to the congressionally appointed committee to look at these things. So, in terms of working with your representatives, you can, they can hear your voice on this, because that's where the next step goes. Then it goes to the president, and then it goes to Congress. In terms of what was pulled and how they did it, they interviewed stakeholders, they interviewed leadership, they pulled data. I saw some information that kind of reinforced what you're saying in terms of some of the data. I can't answer the question in terms of how it was and where they pulled it from altogether. So it came out as the other thing too, I want to emphasize, this came out as a national report that included this catchment. This report wasn't specifically targeted overall for this. It looks at the VA from coast to coast.
If I may also, Mr. Tucker, so the information was pulled. So the RAND Corporation created the employee healthcare model that they use. And obviously, the RAND Corporation has obviously a vested interest. In addition to that, they have the Macmillan Commission, or the Macmillan Corporation, which oversees those numbers that are in those projection models. So if I may, the impact here is moving some of the VA healthcare system to be privatized in conjunction with some of our local facilities. But that, as everybody said here, that's just a flawed model. We tried that. We tried with the Mission Act. It was unsuccessful. It didn't work. And there were significant issues. In addition to that, one of the key issues with that was that veterans were being charged through their private insurance carriers, and the VA was being charged. So sometimes they ended up paying twice for the same care, which Congress, I guess, eventually realized and corrected. But these are just, again, this report, while it's still a recommendation, it is a recommendation, and it does carry some significant weight. So, Congress will review this, but this definitely is going to limit healthcare access to our veterans, and it's going to impede their ability, to secure healthcare. And it's just something that really needs to be seriously and thoroughly reviewed before any action is taken that would adversely impact our population.
Thank you so much. We have the next person on the call, Mr. Epps, Stephen Epps. You have a question? Your hand was raised. Stephen Epps.
This is Ernest Thompson.
No, the next one with their hand raised is Kamini Persad.
Hi, everyone. Oh, there we go.
Sorry.
There we go. Hello.
Okay, Stephen.
Unmuting. Hello.
Yeah, we can hear you now, Stephen.
Oh yes. I've been listening, and everything that's being said, I understand that it's only a proposal right now, and I've got to wonder about the people that make these proposals, because I don't think they serve the day. But do you really think that farming us out is going to give us better care? Because you can believe that we'll be very low priority to these outsourced facilities. Don't fool yourself. All right. You talk about moving the guys in Staten Island to another state, to Jersey. I hope they can afford to do it. Yeah. You talked about St. Albans. Nassau and Queens have got the largest veteran populations in the area, and it has no hospital.
Here, here.
All right. A few years ago, we had to fight just to keep the hospital, the building there where it is, because the VA wanted to tear it down and let the developer have half the land to build a mini Rochdale on it. It seems like nobody cares about vets except when bullets and rockets are flying. All right. And these people that are making these decisions haven't served a day. So, you know, you talk about infrastructure, brick and mortar. Go take a good look at St. Albans. Most of those wards are pristine. And you can run any type of wiring, anything to it that you want to make it modern. You got buildings in Manhattan, 150 years old, that are still being used. But now you're going to talk about a 40 or 50-year-old building that's obsolete. It's ridiculous. Somebody's making money. Let's be real about it. You talk about the Rand Corporation, I'll leave that alone because I think everybody knows where they're coming from. So I'm totally opposed. I'm going to let you know. And I will lobby everybody I can to see to it, to try to see to it that this thing is to the curb. And I'm finished.
Thank you. Kamini, we'll go to you next.
Hi, everyone. I'm sorry if there's any background noise, but I have two questions. Does the city plan on sending the doctors and the staff and the nurses that are currently in the VA hospitals to these facilities that they're going to send the veterans to? And also, does the city understand how long it takes to get an appointment at a VA hospital or clinic? Because right now, I waited 5 months for my initial appointment. So I'm not sure if the city really understands that.
To answer the first question, in terms of the Department of Veterans Affairs, we're so early in this process, we don't know what the final recommendations are and how the impact to staff would be, but the projection is that would be probably at least 10 years out. In terms of the second question about the time to get appointments, I do apologize for that, and I want to make sure everyone's getting appointments timely. We are opening back up. I know that the focus is on this market assessment, but we are opening everything back up. So right now, in terms of being seen in primary care, we're looking at 70 to 80% of pre-COVID numbers.
Thank Monique, next. Monique, I think you're still on mute, so there you go. Oh, we can't hear you, so I'm not sure what connection you have. Oh, well, you get it fixed. Richard Passarelli.
Hi, I have a question for Mr. Tucker and then kind of a follow-up quick statement. So I represent organized labor and the Utility Workers Union of America, along with the AFL-CIO, and it's 1 million veterans that are in organized labor itself. My question for Mr. Tucker is, a lot of the work that's being done on impact is something that is not wholly invested in the fact that what outcomes will look like moving forward. And the big piece of this that I want to make sure that people are advocating on behalf of is the whole mental health crisis that we have in the veteran community, and what impact is going to be shown in those reports on what that's going to look like for our veterans in all the boroughs in New York City, and moving forward, how that's going to be addressed. Care for our mental health in the veteran community, as well as society in general, is something that's been kicked to the curb for a long time, but it's something that needs to be put at the forefront of what we're doing advocacy wise. And, you know, the sad part about it is, as we take a step forward in trying to get more service connected disabilities recognized by the VA, you know, we have this stuff in front of us, and it's disheartening in the veteran community and the legislative work that we're doing, because it's one step forward and 2 steps back. So again, to get off my soapbox, but Mr. Tucker, can you kind of talk through what impact you believe, or have you seen studies on what this is going to look like for mental health for our veterans?
In terms of future state, I can't answer what's going to look like in terms of future state. I can talk about current state and, you know, future state in terms of where we're looking at 1, 2, 3, 4, 5 years down the road, which is we are putting a lot of emphasis on mental health, because you're right, especially coming out of the pandemic, we're going to see a lot more mental health issues coming out of that pandemic and substance abuse. So we want to make sure that we are meeting those needs. But I agree with you. Mental health is a priority, especially right now.
So as of now, though, there is no study that kind of shows what a prospective impact can look like.
If you go through the market assessment, you're going to know as much as I do.
Roger that.
Monique, we'll try you one more time just in case to see if the audio is working.
We need a public health assessment to go along with.
Monique, we're not able to hear you. Next, we'll go to Errol.
How you doing? Can you hear me?
Yes.
Yes. Yeah. So United States Army vet, my concern is this. You know, I've been to the Brooklyn Hospital. I know we're talking about this privatization. And I've been to the healthcare, the mental health ward up there. And I'll just say this, our Vietnam vets are just now to the point where they are expressing themselves and going through what they went through there. And we asked them to deploy solo. We asked them to come back solo. And it's very documented what they went through coming back, spit upon and disgraced. Now, again, we want to close facilities, send them out on their own again. The same as we did when we deployed and redeployed them to Vietnam. And no, we didn't do that to the OIF and the Gen X folks, my generation. And we don't have a plan apparently to remedy that, but it's coming. But I would just ask, and I know this is a recommendation, and all of us that have been in the United States Armed Forces understand what a recommendation actually means. It normally means that's what's going to happen. So I'll say this. Remember what happened to those Vietnam vets who are just now coming to terms with what they went through, being solo and returning solo. And we're asking them one more time, because those first ones up to bat, right? To do the same thing again. When we do this privatization, that's what's going to happen. All right, thank you for your time.
Thank you, Errol.
Next, we have Chad Royer.
Hi, good evening, everyone. So my name is Chad Royer. I'm not a veteran, but I do chair the Veterans Committee and the Community Board. I just want to make 3 quick comments. I'm really concerned about how the suicide rates in our neighborhoods are directly affecting our veterans since they are more likely to commit. I'm also worried about the service delivery that will be heavily compromised if, or rather when we take our veterans outside their circles of comfort. What I wanted to ask, if anyone can answer this question, is when we came to this decision, have we thought about our current members of the military who are currently serving, or those who just came from the Afghan war, and how their transition into civilian life will be affected if we make this change, even on the 10th year from now? I just want to throw that out there. Anyone?
And I think it goes back, I don't have an answer to that question because I wasn't involved in the assessment. I have been involved in terms of the rollout of the recommendations, but, and at this point, I want to emphasize that the veteran is the center of care here. In 10 years down the road, I can't predict what's going to be happening, but I predict in 10 years, veterans are still going to be the center of care. What we're doing right now until there's final recommendations, or not even recommendations, whatever is finally approved, we're still moving forward with our plans. The one thing I do want to emphasize is that mental health, which has been brought up, especially coming out of the pandemic, is something that really has to be focused on in terms of suicide prevention, depression, substance abuse, because we do have to meet those needs to ensure that we're providing the right care at the right time.
Next, we have Dondi McKellar.
Hi, thank you for your time. I suffer from a rare tumor and lung cancer, and I'm fortunate to be seen at the Brooklyn VA along with Memorial Sloan Kettering. And I'm going to make this story really quick. During the pandemic, I needed to have my procedure done, whereas Memorial Sloan Kettering could not accommodate me due to the fact that I live alone, and during this procedure, you have to have someone there to pick you up, to bring you back home. And Memorial Sloan Kettering could not accommodate me to let me stay overnight, whereas the Brooklyn VA was able to send a car to pick me up, to keep me there and before the procedure, and also to hold me until I can actually be functional after the procedure for like a day or two to send me home by car. Memorial Sloan Kettering is one of the greatest cancer institutes, I guess, around, that's out there, but they couldn't provide that service that I needed. And I was wondering if we're looking at outsourcing, are we looking at this total package that the veteran will be receiving from these other sources? Thank you for your time.
Well, and I want to thank you for that story, because the VA does a lot. I think, the VA does a lot of great things, and we have great staff, and we have great doctors, great nurses that come in and provide that care. So thank you. In terms of what things would look like, I couldn't tell you what it's going to look like. I know in terms of looking at aging infrastructure, in terms of providing care, this is the recommendation that came out of the market assessment. So in terms of what it's going to finally look like when it's rolled out, I don't have a prediction on how that would look. But I do want to thank you for that, because we do want to emphasize that the veteran is center of the care. And I think the example you gave really shows that.
Thank you.
Next, we have Craig Caruana.
Hi, everybody. Mr. Tucker, if you touched on an issue before that I think you should expand upon. The VA already has a challenge in getting veterans to, trust them up front, especially for recently transitioning veterans, to get them into the system. And my concern, there's several concerns, of course, that all the other veterans, the veterans on this call have mentioned, but a big concern, I think, is if this plan succeeds, even, in other words, if the privatization / network that you're looking to build succeeds, you're almost forfeiting the idea that the VA itself is going to take care of you. Just as the service members serve the government, now, the government is supposed to serve them. And once that happens, I mean, why should a veteran go to this new, public-private partnership? I think just in reality, if this goes forward, it's going to come across just as any other insurance plan. And that uniqueness of what the VA is offering, that message is going to be gone. And it's going to be just that much harder to attract, recently transitioning, recently discharged veterans, into this system. And, maybe if you could speak to, have you guys thought about this? Is there discussions about this? I think this is a problem that, really needs to be explored.
In terms of what this would look like when there's a final recommendation, I agree with you in terms of how that's rolled out and how that's promoted. At this point right now, we are literally 4 weeks past the public release, so it hasn't gone that far. In terms of what we're doing right now, I agree with you. We have to make sure that we're engaging those veterans that haven't used the VAs, especially those that don't have insurance that really could use us in healthcare.
Samuel Coates next.
Well, I'm a veteran, 34-year retired. So I'm gonna put it like this. We all veterans, we are very territorial, Mr. Tucker, very territorial. I also work for the VA. So I work out of Staten Island. And I will tell you this, for the 5 years that I've been working here, Staten Island is territorial. And the vets want to go to Staten Island. If I go to Brooklyn, the vets want to go to Brooklyn. They don't want to go to Manhattan. They don't want to go to St. Albans. The vets are very territorial. Me as a vet, I have to travel to Manhattan for my own things. But have you been on the train? Do you know that I have to wake up at 6 in the morning just to make it to an 8 o'clock appointment? And I will say this, Mr. Tucker, I ain't trying to bash the VA. The VA is great. We do have transportation, but not at 5 in the morning to get to us. Some of this, and I will let you know because they bombard me with this. Staten Island vets are going to New Jersey. Staten Island vets are going to the Bronx. And they're waking up at 5 in the morning. So I was, I'm trying to help them as a worker, but as for myself, I have to do this myself. And I will say one thing, I served 34 years. For 34 years, Fort Dix and Fort Hamilton should be closed by now. And it hasn't happened. So I feel the same thing about the VA. It will take about 10 to 20 years before they close the VA. That's my opinion.
Hey, I'm surprised we haven't met. I've been out there a couple times. So
I'm the vet center.
What's that?
I'm the vet center. So
vet center. Oh, okay. I thought you were at the
got me.
Okay, I thought you were at the
wanted-
clinic. Okay, so I apologize. So we were probably on the vet center meeting I did last month on this then, right? No? Okay. So that's why we had met when I've been out at Staten Island Clinic a couple times. You're at the vet center.
Michael Moreno.
Good evening, everyone. My name is Michael Marino, and I'm a Vietnam veteran. I'm with the Vietnam Veterans of America, Chapter 126. And a lot of the meetings I go to, and we discuss among veterans about what's happening with this proposal. Everyone says, oh, that's 10 years down the road. And I'm thinking to myself, no, I don't think so. I think that once this plan goes into effect, you can start the day after it's signed in. So I think that 10-year period is the 10-year, that's completion period. So I think it's very important that we start either to nip this in the bud. I know we're trying to save the tri-state area or New York in particular, but this is national-wide, and it requires us to go maybe outside of our boundary to get other people to see if we can defeat this. I don't know why everybody's accepting it. Why don't we just try through our political or local political people, just nip this in the bud and say, forget it, Mr. President. We don't want you to look at this particular proposal. We want you to help us in the way we want to be helped, not what some consultant decides that this is the best way to do things. No, they don't understand. These people cannot understand what veterans are all about. I don't want to be outsourced to some doctor who I walk in and it's probably the first, second, or third veteran he's ever seen in his life and talked to. I mean, at the hospital, at the veterans hospitals and these centers, they know us. They've seen, they do nothing but take care of veterans, and they know in advance certain things that can be wrong with them by their age, by their blood type. They know more than the average doctor. Okay, and we have to do something to nip this, to get this done out of the way. And I don't know where we're fighting for this little piece and they're going to do this to that little piece. Let's just kill the thing altogether. And if everyone unites with enough power, maybe they'll take New York out of it, maybe not, but that's my feelings. Thank you.
It's not going to happen.
I know. Hey, I got to say what I got to say.
Thank you, Michael. Next is Pamela.
Hi. I've been here before, not here before, but had a discussion about the VA and my personal experiences. I also left a question in the email. So today I just want to touch on how more convenient it would be for us veterans who do not have a car or who can't afford to go from New Jersey to from Staten Island to New Jersey.
Pamela's breaking up, but I think the crux of her question is, what are we doing about those veterans that cannot afford to go from Staten Island to New Jersey or Queens to the Bronx or Brooklyn all the way to the Bronx? What are going to be the options for them?
If they need.
The floor is open to answer.
Okay, I wasn't sure she was finished there. I think that process would still have to be worked out depending on what is the final recommendations. Like right now, we are working on trying to even establish some transportation between Northport and Manhattan, New Jersey, Manhattan. We do have transportation that comes from Wilkes-Barre to Manhattan right now. So in terms of what would happen with the final recommendations, I think that would still have to be a process that would have to be worked out.
If I may, for those veterans requiring to be transported to the Bronx, we have Betty Travel. But in addition to Betty Travel, we have the VTS program, the Veterans Transportation Service, at no cost to veterans. And we currently utilize that one to service veterans from Northport and other surrounding facilities, including Manhattan and Brooklyn. I just also wanted to add one more thing. The gentleman that brought up the question about the transitioning service members and the suicide prevention. We currently offer, we have two initiatives that are going on, Project Life Force. And this Project Life Force is a peer-to-peer counseling session that is spearheaded by one of our mental health specialists and clinical psychologists, Marion Goodman. In addition to that, it includes a 90-minute group therapy session for 10 sessions lasting for about 3 months. I'd like for you to afford actually contact Marion Goodman if you're interested in this program. We have a group suicide safety planning and skills intervention as well as part of this program. And the transitioning service members, we have a new initiative led by one of our own clinical psychologist, George Racy, which really focuses on the peer support for the transitioning service member, because they have identified a gap between, upon discharge for DOD and enrollment in the VA healthcare. There is a gap there which produces vulnerability. So the intent here, and we have been very successful initially to enroll several veterans, not only from New York, but outside of New York State, to help with this transitioning, because we understand that the transitioning piece is really a very specialized area that could be very sensitive, and suicide rates actually increase. So in order to reduce that, we've developed a transitioning service member suicide prevention center led by George Racy. So I really like for you to, if you can, establish some contact both with Dr. Marion Goodman and George Racy here at the Bronx. And I'd also like to add the comments made by the gentleman from the OSTOS office. Although the projected declining veteran population is anticipated to decrease there, but the demand for services is going to increase. And in particular for primary care and mental health. And our facility is gearing up to not only continue to provide enhanced services, but for that expansion. And therefore, we are expanding our outpatient clinics. We're enhancing services for transportation. We are partnering with the academic affiliates. As you know, we are a teaching institution, teaching medical center. So the idea is to really develop that cadre of physicians and specialty care services to meet the demands of our veterans. So I just wanted to mention that.
I just want to say, and thank everybody for letting me speak. The notion of veterans by the hundreds or thousands being forced to commute from one borough to another to get the treatment that they once got in their own county, in their own borough. The notion of that happening is such a violation of the standard of care as to be criminal. I mean, I hope that's not the direction. It remains to me unclear what, if any, facilities are going to be closed. And I just
violation of common sense as well. I mean, there's no way someone working in the younger generation can take all day to get up to the Bronx from downtown Manhattan. Like I just will no longer be a VA, patient, I guess, that if that's the conclusion.
Well, the one thing I just want to clarify, if that recommendation did go through, there would be care still in Manhattan.
I just hope we're on the same page with that. I hope I've made that point and that enough people have agreed that those who can make any decisions on potential closures understand and see it in that same way that we would be for. Can you imagine we're going to force veterans by the hundreds or thousands? If that's what this means, right? If there's no, I mean, yeah, there needs to be some kind of public health survey to go along with this infrastructure survey and a standard of care survey. I mean, that's got to be researched as well, in addition to these recommendations.
May I speak? I don't have the hand there to raise my hand.
I'm just going to ask for one for William, Frank. So I'll do William and
Okay.
then John on the board, and then I'll call on you, Frank. Thanks.
Okay, thank you.
So William, the floor is yours.
Is that me?
Yep. Mm-hmm.
Oh, hi. I'm a 33-year Air Force veteran, Desert Storm and Iraqi Freedom, active duty and reserve. My father's a World War II veteran, 99 years old. He's still with us, and we use the facility in Brooklyn. And my first question is, who initiated this assessment, and how much did the assessment cost us taxpayers? And then,
apologize for that. I don't have an answer for that.
okay, I know you are all supporting us, so I'm not picking on you all, but I think it's important we find out who initiated this. So like everybody's complaining to you all, and you seem to be supportive of this, none of this happening. So, it would be a good point that we go after the people who initiated this and wasted the money for it. Monies that could have been utilized to upgrade and help the VA system, which, you talk about the facilities needs upgrading. They do. The one in Brooklyn, I think, is very nice. It's clean. Yeah, the elevators break and there's stuff that goes on. But the other part of my point is, even though, and I don't mean anybody on this line, but these facilities that we utilize are part of psychologically help us. We feel we're in our comfort zone when we're at these locations. And if you take that away or move people, it's going to have a very, very bad impact psychologically on the people and probably increase suicide. So some of these people, this is their second home, going to the facility. Even though I understand that's not what it's there for, but we need to take care of each other because we're the ones who made it all happen by serving in our different conflicts. And as for the New York City area, the 5 boroughs, this is the largest city in the country. And closing a couple of facilities or farming it out to the public or private facility is a very, very bad idea. And I don't think it would work because, again, it goes back to the veterans feel comfortable in their comfort zone at the VA dealing with the people they deal with. And I know this is projected 10 years out, but it is something, like someone said before, we need to hit on the nail on the head right now and going after the people who are against us, whether it's the politicians. We don't get a lot of support from the politicians no more because most of them have never even served. So the newer versions of politicians, most of them haven't served, so you don't have that big political support no more. So we as a group, as veterans throughout the country, would have to go after these individuals who don't support us. And the way you do that is, letters, whether maybe a demonstration, not a bad one, marching, or going after advertisers or people that support them, going after them that, hey, these people aren't supporting us. I hope I was clear.
Clear as a bell.
And just side note, hope to have all the elevators up and operational in Brooklyn by mid-May.
Thanks. John, we'll turn over to you. John Rowan, member of the advisory board.
Thanks, Mercedes. Thanks, everyone. It's good to see a lot of the elected officials and their representatives on this call. And several of us did some outreach to encourage people to participate. It's just a quick answer to the last gentleman's question. This actually goes back to the Mission Act under the Trump administration, which was proposing all kinds of things with regards to the VA. And then it got into this proposal. I'm a Vietnam vet. I've been around long enough. I think this is now the fourth effort to close the Manhattan VA hospital. They've all failed. In fact, if anything, the VA hospital in Manhattan's been upgraded, particularly if you recall after the flood, and they had to redo all the electrical and power supply stuff and move it up from the basement where it got flooded to, I think, either the second or the third floor. I'm old enough again to have a father who was in that hospital in Manhattan on the original VA hospital, which is actually the first of 3 sections over there, which is the one closer to the river, which has got some clinics in it now and a few other things. And I am a user of that hospital. I've been using it more often lately than I prefer to, thankfully. But this is purely political now. And it's going to be, and in that regard, I can only report that it's been really good to see the support from everyone on the House and the Senate folks, the representatives that we have, and the local elected officials and state assembly, state senate members, Councilmember Holden and the committee, the city council are all concerned about these closure proposals and are supporting the veterans, which is one of the key things. This report, again, as was noted, was done very poorly because it was done during COVID, which was the worst time to try to get any data. There is no question that the population of veterans in the United States is shrinking. And unfortunately, some of our colleagues who lived in New York decided Florida was a better place for them. They'll live to regret that, but whatever. The bottom line is that we need to get the politicians involved. When we had a little demonstration out in Brooklyn in front of the VA hospital out there, Congresswoman Malliotakis and Staten Island Borough President were there. They echoed their support for the veterans and their being against closing that hospital. In the Manhattan, we had another demonstration with Senator Schumer and Congresswoman Maloney, 2 state senators and a state assemblyman, and Councilmember Holden as well, where we supported keeping that facility open. I don't doubt that they're going to keep it open for quite a while yet. They've spent too much money, particularly on the Manhattan Hospital, and doing renovations to close this facility. The other thing is, nobody asked the question is who would pick up the slack if the VA hospital is closed? Everybody should know that every VA hospital is run by an outside medical facility, a medical school. NYU, for all intents and purposes, is the main supporter of the VA hospital in Manhattan, for example. It's also the main supporter of the Bellevue, New York City Hospital on First Avenue, as well as their own facility further up on First Avenue. They are not going to be in a rush to take over the VA, believe me. The last couple of times they tried to do this, NYU was our biggest supporter. The Langone Medical Center and the medical school were all in support of keeping the facility open. They don't want to close it either. So I think we're in pretty good shape. The question that we need to think about is, what do we do to ensure that the facility stays open and to ensure that the upcoming population of younger veterans from post 9/11 contingent, many of whom are not so young anymore. Sorry, Jennifer. But you know, some of the new members on the Board of Veterans Advisory Board are all more recent vintage veterans. But the truth is that there's some bills sitting in Congress right now called the PACT Act. It was passed in the House, unfortunately, with only 24 Republicans supporting it, all the Democrats and 24 Republicans. And this isn't really political. It just gets into this interesting, weird politics sometimes that occurs in the federal level. Congresswoman Malliotakis voted for the bill. So did Congressman Garbarino out of Long Island. So did Congressman Reed and Congressman Katko in upstate New York. However, 4 members did not, which I won't get into there. We are waiting to find out what's going to happen in the Senate. We're waiting for a companion bill, as they often have to do. The Senate will have to pass the House Act as is in order to get the benefits we need. One of the key aspects of that bill is the fact that it opens up the VA hospital system to the newer veterans completely, whether they have disability or not, whether they're rich or poor or whatever. It's the one thing they cut us, the Vietnam veterans, out of the VA system when they cut out the category 8s, as they used to call them. And they need to keep these people in the system because, unfortunately, because of the toxic exposures from the burn pits and other issues in the United States and abroad, unfortunately, many of these veterans, as they get older, are going to find themselves needing medical care.
John, sorry, we got to wrap it. We got to wrap it up and go to the next one.
Yeah. So please call your senators, call your friends in the other states who have Republicans in the Senate. Tell them, please vote for this bill. Money is not the issue when it comes to veterans.
But also, if it passes, it would yield more thoroughfare through the VAs theoretically as well, I think is one of the key points.
Yep.
And next we have Frank Russo.
Okay. Thank you. My name is Frank Russo. I'm a Vietnam veteran. I belong to VBA Chapter 421 in Staten Island. I keep hearing this timeline of 10 years, 10 years. So what do? We're just going to sit back and let everything happen and wait for the 10-year mark? Well, I plan on being around in 10 years. So do a lot of other Vietnam veterans. So what are you going to do? They're going to pull the rug from under us? And then to boot, you're asking the new veterans of Afghanistan and Iraq to join the crowd. So what are you going to do? You're going to meld them in and then just pull the rug out again the same way. Any comments, please? Thank you.
Yeah, can you guys hear me? I'd like to make a comment on that.
Very quickly.
Okay. What John, Rowan, and Frank saying, I just want to add a little bit different view of this. And I'm Bobby Tambori, Marine Corps Veteran Service Officer, and I'm a Gold Star family member. At this time period, whenever discussion of cutting any kind of service, for whatever reason, and everybody who's on our side and not on our side and all that, look at the time period. This is the most egregious I could ever see for the Vietnam veterans. They're the one. I mean, I didn't take a poll or any kind of official statistic, but it doesn't take a brain surgeon to figure out they're the ones being treated right now more than anybody as the Vietnam veterans. So let's say, okay, since we treated them the way we treated them when they came home, like they were criminals or worse, volunteers would go to spit on them or call them foul words and names. Whereas today, thank God, if they go volunteer, say welcome home at the airports. But, they got to go through that coming home. They got traumatized over and over and over again. They didn't get the VA care they should have gotten when they came home. And now it's their turn in their last years walking this earth. Honestly, we're all getting older, and this is going to be the last stretch for their medical and psychological and all their care. So I think it's most egregious that the Vietnam veterans are taking this possible, even maybe could be hit more than any other veteran at this time. And that's what I got to say. Thank you.
Here.
Thank you.
I did want to call in Jennifer Komorowski. She's a member of the advisory board, but she had a lot of good questions that were submitted in the chat before. And I think those were very pertinent, especially to both Bruce and Rosemary to answer.
Yeah, sorry, I didn't raise my hand, Mercedes, but thanks for that. I took a lot of time to look through the report, and I've been in consulting for close to 17 years now. So I do a lot of similar assessments on this topic. And I just saw a lot of fuzzy numbers. And this continuous reference back to the quality of care of the veteran, but not necessarily criteria established to evaluate that point. References to mileage, destinations, and we all know that this is a nuanced market and it's very difficult to kind of get around from borough to borough with the traffic, and no anomalies like that reflected or taken into consideration. And the only non-fuzzy number was, dollars and cents and cost references. Further, when you're talking about percentage, the percentage in Ohio, the 2% in Ohio is 10 people. In New York City, it could be 2,000. We don't know, and that's very unclear in how it's laid out in the report. So that just raises a lot of concerns. So some of my commentary was perhaps a little cheeky, but just to kind of call attention to those considerations, because I just didn't see it in the meat of the report, which was concerning.
And Jennifer, thank you for taking a look at that report as thoroughly as you have. So if you've looked through the report, then you've seen kind of the recommendations in terms of the numbers and the polling, and Rosemary and I can't really address how those numbers were interpreted. So I apologize for that.
Yeah, no, I understand that. I don't think that's necessarily on you. I think it was done at a higher level, but I think that's hopefully something that our politicians reflect upon when this goes for consideration. It comes across as cost as the primary consideration, and that's unfortunate for those of us who know who served our country. It's disappointing.
And then Pamela, we have you. Hopefully there's a better connection.
Can you hear me now? Because I had to change devices.
Clear.
But no, I'm talking about transportation. I was talking about how more convenient it would be if that Brooklyn VA was picked up and moved in a central area when everybody can get there more conveniently, and it would cost less money. Plus, and then you talk about the transportation. How much does the VA, spend on transportation when you really? I think it would work. I'm just saying, I think it would work if we collaborate, and you still have the vets. So we still have veteran doctors. If we still have all of that in place and we all collaborate together, I think it would work.
You close that facility, forget about it. It ain't gonna happen.
You know what? I'm listening to all the old timers, and I'm not gonna even put anything on it. But I'm a female, and I'm not getting the services that I need. So that's why I feel this way. And I'm a female of color at that. I'm not here to cause no problems, but I'm telling you, I'm not getting mine. And there's a lot of us that are not getting ours. And there's a lot of us out there who don't have the money, who don't have the ways of getting. So if you put it center and central and put it where it's more convenient, yes. I disagree with all of you back there crying about moving it. It's not serving us. It's not serving us younger people, even though I'm in the middle now. I'm a Desert Storm vet.
Pamela, I just want to say,
ma'am, you truly speak for yourself, but there are people here that could help you. There are people that could help you navigate.
Oh, you have no idea how many times I have reached out, and there are people on this call right now. No,
I'll message you. Truly, there are people here that could help you with that, but I don't think that's
anxiety attacks going into the VA hospital.
Who does that? I would, if you were comfortable, I'd be happy or have somebody reach out to you to make sure that you get what you need, because that is important. And I apologize that you're not getting.
They've made a big mistake and they won't fix it. So that's one thing.
And they're not great with women. I had to go through a hell of, I hear what you're saying, because I had to go through a hell of a fight. It took me a year of fighting with the local VA here to get some basic things. They are not great with the women, and I lambasted them over this about some of the stuff that they're doing. But the solution is not to burn it down. The solution is make it work.
Right. And so I'm saying push it, more people, or let us go out. I'm saying let us go out. A specialty. I'm a breast cancer a survivor, and I had residents operate doing a specialty surgery on me, and it failed. And now I'm here I already explained it so many times, but they won't fix it.
Right.
I've had a lot of personal issues with the VA myself. I'm an Iraq War veteran.
Okay.
But I just want to say that it is just a statistical fact that the majority of our veterans treated in the VA are older, and that's a very specific interest and demographic that needs to be considered.
Some of the doctors too. Have been around a long time, and
their specific needs need to be first and foremost, especially like the gentleman was saying about Vietnam veterans. But I sent you my
okay. Okay. Thank you.
There was a question in the chat earlier that I think is pertinent, and I think that it is worthwhile addressing. Chad Royer asked, how would these private partners be held accountable for the services rendered if it did go to privatization, hypothetically?
You know, I can only answer how it's happened now, how it does happen now. So if there are issues, it is reviewed, and then we work with the facilities in which they are in. Let's say, you know, pick a community hospital. If something happens that's not, you know, a bad outcome, we would then work with that, and we're paying for it. We'd work with that hospital and QM, and our QM does look at that. You know, in terms of how it was going to look down the road, like I said, I don't have an answer for that, but I can tell you how it works right now.
And I just have to emphasize one thing, you know, although the recommendations call for some facilities to close and the notion of privatization of services, locally, we at the hospital and medical centers are committed to operational excellence on the medicine and surgery side and to keeping care within the VA. I have to put that out there. You know, community care, privatization for us is really, you know, we're not a fan locally. They made those recommendations while they may move forth. We're committed to keeping care within the VA. That's all.
And I just want to bring up this one question by Marty in the chat, Marty Edelman, that says, the Manhattan VVA chapter are getting a wide range of services. And a lot of times when we go to the VA, I use the Manhattan VA, you can get your PCP, your dermatology, your gastro all at the same time. So what alternative medical facilities will be able to provide the same level of service that we're currently getting at the Manhattan VA? I know we talk about using the NYU facilities, but a lot of times it's specialized here, specialized there, as opposed, you know, right now we can get it all in one-stop shop. So now are we going to have to go to multiple facilities, multiple appointments when before we can get all in one day? How is that going to work?
If this passed as written, you might have some of that. If you took Manhattan and there was a strategic partner that could supply all those, that could potentially happen right there in Manhattan. In Brooklyn, what's being discussed is having a multi-service outpatient clinic more centered in Brooklyn. So then you might have some more of that someplace else. It would be with that strategic partner, but you know, there's not a way to predict that at this point because you don't know how that would play out.
And yet you're going to try to close the hospitals. Doesn't make sense.
The privatization will just add another layer of bureaucracy. That's the bottom line. Not to mention cash cows, because that's the way I see it.
Well, that's their recommendation. We're committed locally to keep the care in the VA. We want you to choose VA. We don't want you going out to the community.
And I can speak for the harbor that we don't send a whole lot out into the community.
And rightly so.
Can I just add a point to this discussion? I've spoken with some of the colleagues and some of you on here regarding that privatization model, but the cost, and I'm not sure if a lot of you are familiar, obviously a significant amount of funds are approved by Congress to address our healthcare needs. But once those facilities are closed, the cost is going to fall. The burden of the cost is going to fall on the state and the city to provide that healthcare in those healthcare facilities if they do the partnership. And that's a mammoth asking for the state and for the city to absorb some of those costs that will
come with the veterans' healthcare needs. And some of these organizations and private facilities will not. They won't spend that significant amount of money. So just something else to think about. You know, I know we're looking at or the recommendation is looking at privatization, but the amount of money that's going to have to come with that, you know, on the private sector, through the state, through the city, it's a mammoth asking. So I'm not sure if many of them will want to even bankroll that.
Thank you, everybody, for your participation in this excellent VAB session. This discussion, it will not be the last. We have our next VAB session. It will be in June. It will be on Zoom. Look for your email addresses, so your questions, and we thank Mr. Tucker. We thank Rosemary, Ms. Santiago. We thank everybody for being on the call. And before we close out, we definitely want to have the commissioner have words before we leave. And we're going to come back again, because this is going to be a continuous discussion. And we're going to have other questions. I know other things were coming in my mind, and I was just jotting them down. And I'm going to reach out to Mr. Tucker and Ms. Santiago with those questions. We're also recording this. So if you put your email address in the chat, we could deliver this recording to you, so you'll have it. And we hope that you will join us again in April. We want to keep the discussion going, keep the momentum going, because again, I'm a firm believer, you know what I'm saying? We have to make sure that the services, when individuals say thank you for your service, the services that we receive must equate to the service that we gave. I say we, I'm a Desert Storm Persian Gulf era vet. So we have to make sure that we communicate, we have more education, we talk about it, because we have to make sure we're at the table in these discussions. I'm not one to be one to, we have to advocate for the needs, and we can't get the right services if we don't bring our brothers and sister veterans, active duty, whoever on this call, so the individuals can hear, the powers that be can hear, you know what I'm saying, what we need and what's happening with us in real time, not their visual time, all right? So I'm going to ask Commissioner Hendon to have some remarks for about 2 minutes, and then we definitely have to close out, because we have a hard stop at 8, and we want to make sure that we get this video uploaded and get everything out to you as well. Is that all right? Everybody raise your hand. You're good? Thank you so much. Thank you so much. Commissioner Hendon, you want to close us out 2 minutes so we can exit and get the information out to the individuals. Thank you so much, everybody.
Wendy, thank you so much just for bringing us together like this tonight. To you and all members of the board, we truly appreciate you creating the space, and also echoing the thanks to Bruce Tucker and to Rosemary Constantine Santiago from Harbor Health and from Bronx, VA, for being with us for all this time. We put the information about how to reach out to us if you need anything on the city side, as far as any assistance for the New York City Department of Veteran Services. To say it, the number is 212-416-5250, 212-416-5250. nyc.gov/vets, nyc.gov/vets, and then connect@veterans.nyc.gov if you need to email us. Connect@veterans.nyc.gov if you need to email us. And for social media, it's @NYC Veterans, @NYC Veterans. The video, once it's up, it'll be at nyc.gov/vet board, the website for the Veterans Advisory Board. So once it's up, as soon as we get it, we'll make sure it's up on nyc.gov/vet board. And then last thing, I messaged somebody about this just now. You know, the veterans who came before us fought for us to have what we have. And it's our turn right now as far as this fight. And this is an ongoing thing. And so I hate that it is like this, but know that we are in the foxhole with all of you on it, echoing the words that the mayor has said on this, in that we stand with our veterans as far as anything that be done to make sure we don't see a closure of the Veteran Affairs Medical Center and the campus in Brooklyn, the campus in Manhattan. Make sure our brothers and sisters in Staten Island are not to go to East Orange for their support, but to continue to stay within their state and their city. And so we stand by you with all of these things, and we appreciate you so much. Thank you so much, and back to you, Wendy.
Thank you so much, everyone. Thank you, thank you, thank you. You are truly appreciated, purely appreciated for everything that you've shared. It has been an awesome. So guess what? I challenge you on the next VAB meeting, bring somebody else with you. Tonight, we had 100 people on this call giving their information and their remarks. We need to keep it. The next VAB, the bandwidth, will expand it. I need everybody to take the initiative and bring another veteran with you on this call. All right, so that we make sure utilize this space as a discussion center, an education center, where we're able to discuss the issues, we're able to communicate, and we're also able to get the results that we need. All right, is everybody, all hearts and minds clear? Everybody good? Have a great evening.
We're good.
Enjoy the weather tomorrow. It's gonna be 80 degrees. All right, don't take off your clothes too fast. It might be 50 the next day. We don't want anybody to get sick, okay?
Too late.
Thank you so much. Have a great night.
God bless,
Commissioner
Madam
Hogan,
Chair.
and then if you're
Night.
still on the call, thank you so much. Mr. Valone, thank you so much. All of our elected officials, thank you so much. To the VAB, thank you so much. Everybody, I don't want to leave anybody out. Thank you so much. Have a great night.
Thank you.
Hi,
Thank you.
James.
everyone.
Bye-bye.
Hey, James.